Hey, Jen.
Hey, Dana. Hi, everyone,
Welcome to Hypnosis.
and beyond. Today we have Dr. Roberta Garceau. She is a practicing dentist, certified yoga and Ayurveda instructor, and author of Bliss Not Burnout.
We're thrilled to have you. We are so interested in hearing about what you do and how you do it and all that good stuff.
All right. So I am a dentist. I am a yoga and Ayurveda instructor. I just love wellness. And so for decades, I've been all about whole health, right? So practicing dentistry as a general dentist, I've always been interested in the whole person, not just their teeth and gums, right? And as I became a yoga instructor and learned more about Ayurveda, which is the sister science to yoga, it's just another alternative form of medicine that's been around for thousands of years. And I incorporate that into my whole wellness picture, which is elemental wellness. And that includes Western medicine, Ayurveda, yoga, mindfulness, meditation, breathing. I'm also a diplomate with the American Board of Dental Sleep Medicine, so I help people to breathe, sleep, and live with greater wellness in many, many ways. So for me, it's you just can't dissect any of these pieces out, right? They just all go together. And so my day job is as a dentist, and I incorporate all of those things into the dentistry that I offer to my patients. So it's
Wow.
everything from their oral health. So it's pretty common knowledge that there's the connection between oral and systemic health, right? If you've got inflammation in your mouth, you've got inflammation in the rest of your body, and vice versa. So by keeping inflammation under control in your mouth, we're helping all the other organ systems. And likewise, if the other organ systems are acting cranky and irritated, and we're going to see that in the mouth. And so I just like to offer first awareness for patients and ourselves, right? Just that awareness, because in life today, we're just all on autopilot and running from one thing to the next, particularly during holidays and busy times of the year. And so it's coming back to that awareness of what is even going on with me right now, in order to be able to help yourself. And that's how it is with my patients. I observe when they come into the office, I look at their energy, and rather than going to a judgment or a label like, oh, he's a driver, or she's crazy cuckoo, she's all over the place, she's frenetic. I really look at their energy from an elemental wellness Ayurvedic perspective, which is, oh, he's got a lot of fire element going on right now. So how might I want to manage myself first and then help him? Or she's really got a lot of air, wind, and space going on right now. How do I ground myself first so I can also help her? So it's just a different way of looking at life and people and oneself in the first place, in order to view the world with less judgment. Because when we view things as a witness and view life as an observer or participating observer, it gives us more tools and clarity to know how to approach things the best.
Wow. Well, I mean, I love it.
Yeah.
That's amazing. Did you sort of always have an interest in a holistic approach, or because I don't know that I've heard of many dentists that and obviously you're much more than just that. I just since that's your day job, I find that really interesting. What led you down this path?
I've always believed that it's all connected, right? Like you can't have physical health when there's a lot of mental turmoil going on, right? And you can't have mental health if you're physically very diseased. Like it's all related and connected. So I can't even imagine looking at health and wellness in any other way but a more holistic, integrated perspective. And, the term holistic dentist, I think that has different meanings or connotations for different people. So there may be some dentists who call themselves holistic, and it's not right or wrong. It's just their definition for themselves, right? And they maybe remove amalgam fillings with a particular evacuation system or a detoxification system or something like that, right? That's one version of holistic dentistry that I've heard of. And then there's more my approach, which again is more whole person. So if someone comes in and I sense that something's off and they're going to sit down and I'm going to inject them with a needle and their face is going to feel strange and they're going to have to lie still for an hour in a vulnerable position, but I sense that something's off, like we kind of got to get that on the table first, right? I'm not just there to do a procedure and a thing on a person. Um, I'm there to help a human being. And so that means I need to see the whole person. How else can I explain that is if one approach would be you're having sinus congestion. And so let's take some medication for that. Let's take a decongestant. That is more of a modern medicine approach to decongesting the sinuses, right? And there's also a more traditional holistic approach, which is maybe using saline spray or a neti pot, which is becoming more mainstream. So people who use neti pots and do alternative things like that may not even realize that they're practicing Ayurveda, right? They may not even know that word or be familiar with it, but here they are practicing it. As a matter of fact, when I started to study Ayurveda, my husband was like, "Oh, are you gonna kind of get foo-foo and hippie and weirdo on me and everything?" And I'm like, "No, I'm just becoming more of myself." But then here he is using the neti pot. I'm like, "Dude, you're using supplements and herbs that were recommended thousands of years ago because people recognized the value of these things and the medicinal use of herbs and supplements and food as medicine." Holistic for me is looking at the whole person, and it's also looking at maybe some alternative approaches to things. If someone, I tip them back in the chair and I happen to notice because I get to look up there, people, that they've got a bloody nose, they've got a little dry blood crusted up in there. Well, I'm going to offer them, maybe you want to try using a little bit of oil. It's called nausea. Use a little oil on your pinky finger and just kind of swipe it inside the nostrils to moisturize and lubricate, especially in the drier winter months. That's something different than putting an antibiotic up your nose or something like that. If it's a food grade organic oil that you can drink and eat, you can certainly put it in your nose or other body parts. Um, you can also oil pull. That's something that's gotten some social media recognition. While I don't say that it would replace flossing your teeth for cleaning between your teeth, there are patients for whom that's useful. People who have dry mouth, so people who are on polypharmacy or where they're taking a lot of medications where the side effect would be dry mouth, or people who are undergoing cancer treatments or immunosuppressive treatments where the mouth is affected. Maybe the saliva flow is not as good. Using oil as an oral moisturizer is a wonderful tool, and you can swallow it or you can spit it in the trash. But it's another approach rather than here's something from the pharmacy, here's another thing from the pharmacy. Um, yeah.
So do you when you talked about the elemental stuff, where does that come from? I'm not very familiar with that.
I'm so glad you asked that because probably,
Oh, good.
many listeners are probably not familiar either. So if I try to condense like a really lot of Ayurveda into a really short nugget, um, in the tradition of Ayurveda, and all that means in Sanskrit is Ayur, Ayur, means life, and Veda, Veda, means wisdom or knowledge. So it's life, wisdom, or life knowledge. It's just the study of life. Again, the sister science to yoga. So you may have listeners and followers who practice yoga or will occasionally take a class, right? This is actually older than that. This is just as old, if not older, and it's a form of medicine that was practiced thousands of years ago and is still practiced today in parts of India. You can still go to Ayurvedic medical school. And so if someone's like, that's cultural appropriation, or is she trying to change my religion or my belief system? Like, no, 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 not at all. First of all, it's not appropriation. If you've ever studied biology in high school, what does that word mean? Bio means life, and ology means the study of. So Ayurveda and biology are almost the same word, right? It's just another perspective, another lens, a more holistic lens, if you will. So in the tradition of Ayurveda, everything in the world is considered to be made up in various proportions of 5 major elements. 5. And so they are earth, water, fire, air or wind used interchangeably, and space. And so, like, my body is made up of all those 5 things. A rock could be made up of all those 5 things. Mostly earth, right? It's dense and stable and solid, and it doesn't move, and it's, hard and smooth and cool, but it's considered that it has a little bit of movement in it, or a little bit of water in it, a little bit of the others. So we're all made up of all these things. And when we look at ourselves and other people in the world through that lens, it takes away the judgment part. So again, when I said that I was describing, say, maybe a patient came into my office and he was agitated about something, could have to do with his appointment. It could have to, maybe he waited 10 minutes and he's mad because he's important, or maybe there's something else going on in his life that has nothing to do with me that he's upset about. Rather than seeing this guy as being angry and aggressive and everything else, I can again just see that he has fire. He's got a lot of fire going on. And so in Ayurveda and elemental wellness, like increases like, and opposites balance. So if this guy comes at me with a lot of fire and he's kind of in my face, and I jump back at him and I'm like, well, you didn't pay your bill and you're a jerk, and this and that, and you weren't nice to
Yeah.
my receptionist, and da 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 da. This is going to happen, right? Fire and fire, it's going to be pretty explosive. Whereas if I say, okay, if we look at the pyramid of the 5 elements, or a triangle, with earth being down here, then water, fire in the middle, air or wind, and then space at the top. If fire's in the middle and I need the opposite to balance it, I'm going to take a little earth and a little space. So I'm going to give him a little space, let him blow his fire out, and I'm just going to be grounded, right? I'm not going to let him walk over me. I'm not going to let him abuse my team members. And by keeping grounded, I'm in the best position to help this person help himself, right? Again, the example of the woman who maybe, rushed from a work meeting, and she rushed through traffic and she rushed into the appointment, and she's like, okay, I'm here for my cleaning. And I'm like, no, you're not. You're here for your crown visit, and I'm going to give you a needle right now. And she's like, I got to be done in an hour because I got to go pick up the kids from daycare, and blah, 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 and she's all over the place. If I say, holy cow, me too, I'm having that kind of a day. Like, I barely got a lunch break, and I got a meeting after this, and I got to, like, you can't believe how busy it's been here today. That's not going to help her, and it's not going to help me. So obviously I'm giving an exaggerated response for effect, but if someone is being very swirly and windy and air and mobile and like scattered and frenetic, then again, I've got to do the bottom. I've got to come down to the earth and be very grounded, and maybe even offer her, an opportunity just to exhale and, settle in a little bit. Ask her what she can do to help herself, right? Like, I see that this has been quite a day for you. So that we can have a good visit today. What is it that you can do to help yourself, and how can I support you with that? Right. So that's
I mean,
holistic.
what a beautiful approach. Yeah. What a beautiful approach to caring for someone, to put yourself in the correct space first. I'd
Mm,
love it if you'd elaborate a little bit more about that, because I don't think that is in general uh, culture, the certainly Western world culture um, seems to be more focused on changing outside forces rather than maybe looking within first.
Right. Everything that I'm about in my book, Bliss Not Burnout, the biggest takeaway is self-awareness first so that you can practice self-care and have self-compassion, right? And from there, you're able to be more aware, caring, and compassionate for others. It's kind of like when you're on an airplane and you listen to those instructions at the beginning. If the oxygen masks come down, put your own mask on first before helping others, right? And it's really true. I learned the hard way, unfortunately, because I got sick. But if when we neglect ourselves, when we, think that we're being super mom or Wonder Woman or, just this altruistic giving person all the time, it's not sustainable. We truly do need to take care of ourselves. It's not selfish. And I know self-care is kind of tossed around and kind of trendy of a word right now, and it's very, very true. Taking care of yourself and being aware of yourself first is essential. You know, um, Don Miguel Ruiz wrote the Four Agreements, and one of those agreements is to not take things personally. And that was a hard pill for me to swallow. It's like, okay, yeah, I'm not that so much important. Everything's not about me. That woman's upset. It may or may have to do a little bit with me, but truly it's really about stuff she's dealing with herself. So me getting upset about her being upset is not helping either of us, right? So really going back to how can I take care of myself first? So I bring my best self to this situation because that's when we're going to have the best outcome. Am I perfect? Oh my gosh, no. Everything is a practice. So of course I lose my patience, I get frustrated, I might become a little have a little irritation coming out. And when
You
you're
have a little
aware,
too much fire every once in a
yeah,
while.
exactly. So how would you help me? Right, and so I know that
Stay
about
grounded.
that's right. So I know that about myself. See what a quick learner you are? Either I'm a good explainer or you're a good learner, Jana. Dana. But,
Yes.
yeah, so taking those breaths and grounding yourself, this is what we can do. If you're fighting yourself in line, over holiday season or any time of the year, and you're waiting online or somebody's having trouble with their form of payment or you just got other things that you'd rather be doing, you can stand online and breathe. Nobody has to know that you're actually kind of soothing yourself and practicing self-care. Just nice, slow, deep breaths in and out through the nose. That simple, that free, always available, doesn't require an expensive membership. It's tapping into the tools and strategies that we really already have, right? We're able to be well if we wouldn't get screwed up with all these other distractions in the world.
Yeah.
I don't know how much you want to talk about when you say you're a holistic dentist. I know that xylitol and all of these other things and the microbiome is really becoming in the forefront when you're looking for a better approach. So if
Mhm.
you could elaborate on all of that stuff.
Okay, so don't give xylitol to your dog. It's toxic. And we know that.
Yeah.
But yeah, things like xylitol, sugar alcohols are have shown to be karyostatic. So they'll guard against cavities. So that could be a good gum to chew or a mint to use if you find that you like those habits but don't want to have sugar in your mouth or other artificial sweeteners that aren't as healthy. At least this one is derived from natural sources. Um, your microbiome, oh my gosh, we could go on for days and days, right? Really, I don't prescribe many medications at all. I don't even want to prescribe antibiotics unless it's absolutely necessary. Because every time we take antibiotics, it messes up the whole gut, and for women, it can mess up other flora. People are coming in, they'll have a yeast infection in their mouth or down south, and it's those are neither of those is fun. As well as it's killing the good bacteria that are in our belly. And so by microbiome, I don't know if you're referring to also that connection between the gut and the brain. between the gut health and the brain health. That if we're killing off bacteria in your system because you have an infected tooth right here, it's also killing all those good bacteria that need to talk to your brain and give it signals and help you to be well and healthy. Our food is so adulterated, and you would think that I would be a fantastic farmer, and I'm not, but I do try to get most of my produce from a local farm that's organic. You know, that is my favorite diet that I promote. So if you want to know my diet secret, it's floss because I'm a dentist. So I say floss. So F is for fresh, L is local, O is organic, S is seasonal, and S is sustainable. So as much as you can to try to eat those things. And so that's why your local farm or farmer's market is great if you're not doing your own gardening or just making different choices at the grocery store. Finding that having, cheese or meat, for instance, that's actually not full of, you know, antibiotics and other byproducts, it actually is good and healthy for you and full of nutrients, that you're going to feel more satisfied and you don't need to eat as much of it. Whether get a box of crackers that's completely processed, right? I don't know about you, but it's happened. I've eaten my way through most of the box because between the salt and the processy, my brain's never getting the signal that it's full. It's just like I want more of that addictive, refined garbage, right? And my belly's not having a good time with that either. It's not going to digest that well. So, for the most part, as much as you can eat fresh, local, organic, seasonal, sustainable. So, in the wintertime, there may not be that much growing outside locally. You've got more of your root vegetables, your things that last longer, or your things that can be canned or put on shelves. Or if you're eating frozen produce, trying to get produce that was fresh frozen, right? If you picked blueberries in July and you froze them up pretty straight away, and then they're still going to be pretty good in the wintertime, right?
Amazing. I have one more question about root canals. What's your take on them?
So do you have a specific question about root canals or just root canals
Yeah,
in general?
because I just had a root canal because I was in a bad situation, but then I went online and there's a whole bunch of different viewpoints about them. Like effectively what I've heard is that it's basically something dead in your mouth and you need to extract it and get it out. You shouldn't be letting it linger and sit there and whatever. So that's the new information I'm hearing.
Okay. So to your point, I think it can be so confusing anymore. There's so much information and everybody online is an
Yeah,
expert, right? Whether they are or they're not. They
That's right. Right.
if they have
exactly.
enough
That's why we need to
promotion.
talk to experts.
Right. So everybody knows the latest and greatest and TikTok is a great place to get your medical information, isn't it? But with regard to root canals, yes, I've had one too. I'm very grateful for it because now my tooth doesn't hurt anymore. Um, yeah, root canal just it describes for the listeners who've never had one. It describes the canal or space that's in the root of the tooth and also a little bit the top of the tooth, what we call the crown of the tooth. So that space contains nerves and blood vessels that were necessary when the tooth was forming. Once your tooth is completely formed and you're an adult and all your teeth are formed, there is no function of that nerve other than to cause you pain. So if you've got recession or wear at the gum line of your tooth, you may have sensitivity there. You get sugar there or something sweet, even a natural sugar. You get anything acidic there, anything that's going to conduct fluids, and all your tooth can do is feel pain. So when we don't need that nerve anymore, if it's become sick because of decay, tooth decay that's gotten in, and the bacteria that makes the decay can, when it's deep enough, it can get through the tubules and get to the nerve inside the tooth and infect it, make it sick, make it inflamed, and over time it can die. So that's one way, or it can happen through trauma, right? So if you fell off your bicycle when you were 10 years old and you bumped your front tooth, and then over time it caught a little brown or gray, That color is because the blood supply that was in the tooth, it has bilirubin and biliverdin. Those are the two pigments in your blood. And when the nerve dies, those pigments leach out. So the bilirubin is red and the biliverdin is green. And when you combine red and green, you got a tooth that's looking either brown or gray. That's why that happens. So those are the two main reasons why a tooth would die, right? Either or a nerve would get sick, either from decay or from trauma. And then once that happens, sick and dead things don't like to stay in our body. And they most especially don't like to stay in an enclosed space of your tooth, right? That's a really tight system there. So the infection, if the tooth is intact, or say you have a good filling on there, but it was a deep one, or you've got a crown on your tooth because there was a lot of decay in the first place, but the nerve seemed okay. And then down the line, you end up with pain or an abscess, like a pimple on the gum or some swelling, and it turns out that the nerve has gone south. The root canal is just a procedure to clean the sick nerve out of your tooth. So we're just cleaning the canal. Sometimes people think that a root canal means you lose your roots, but if we took that all the way through, and that's a common misunderstanding. It's like if you took that all the way through logically, then your tooth would have no roots and you'd have like this marble that fell out of your head, right? So when you have a root canal, you still have your whole tooth. You just don't have the sick nerve and blood supply inside of it. So that's cleaned out, filled with a filling material, and then restored, usually with a crown, sometimes just with a filling. And I definitely think they're worthwhile because there's nothing like your own tooth. I think there are concerns about, oh, if you push the toxins out the tip of the root into the surrounding bone and gum tissue, that happens anyway. That happens if a tooth is infected anyway. The infection is either going to come out the tooth, but again, if you've got a well-fitting filling or crown, it can't come out the tooth, so it's got to go out the tip of the root. And that's why sometimes we'll see a pimple on the gum or some swelling on the gum. It's actually like the infection is burrowing its way through the bone and the gum and creating that there. So I am in favor of root canals most of the time. If a tooth is too far broken down, then it might be better to extract the tooth and consider a dental implant or something like that.
Thank you so much. Because you're a holistic dentist, it's
Yeah.
really great to have your take on it. Because to be fair, there's just so much information out there for people, and you're just like wading through it, and it's hard to make these choices, right? When you think,
And
oh,
it
I'm
can
hurting
be.
myself.
Along
Awesome.
those lines, I'm very curious about gum health. If we, since we're in the technical part of the show, apparently, we're picking your technical brain here, your doctor brain, but um, eh, some people say gum health is even more important than tooth health, or that, if your gums bleed at all, that's a problem, or does that show that there's blood flow, so that's a positive, or I'd love to hear your thoughts about what does a healthy gum actually look like, and how do we help them stay or become healthy if they're not?
Excellent. Right. So healthy gums are firm and pink for the most part. If someone has a dark pigment to the rest of their skin, they may have darker gum tissue or gingiva, but basically it's firm and pink, some shade of pink. Um, Gums that bleeding is not normal. It may be common for some people, but it's not normal and healthy ever. Bleeding gums means that something is inflamed, something is irritated, it's upset. And so, what is the cause? It could be plaque. It could be, tartar or calculus. It could be a popcorn kernel got stuck there and just irritated it temporarily. And, with a little love and attention, is going to pass and get better just fine because your body's really good at healing itself. So, an occasional bit of blood, nothing to be worried about. But if your gums bleed every time you floss, or you spit in the sink after you brush your teeth and there's usually some blood, even a little bit, that's not so good. That's not so good. Because what happens is we all have bacteria in our mouths, right? And if we didn't, we'd be sick, just like we all have bacteria in our gut. Because guess what's the start of digestive tract? The mouth. So it's all connected again, holistically. So we all have bacteria in our mouth that are part of being normal and healthy. If there's an imbalance between the bacteria and what the bacteria are living on, which is plaque and food particles, um, and there's too much acid production, that's when we get tooth decay. If there's too much plaque hanging around the gum tissues and the body is not able to fight off the inflammation, that's when we get gingivitis or periodontitis or gum and bone disease. The best defense is a good offense. So for most folks, that's brushing twice a day and some kind of interdental cleaning, whether it's flossing or floss picking or getting a little tool and implement between the teeth, but something to clean between the teeth, generally at least once a day. That's the best offense. And if you're not in the habit of those things and you start flossing and you're like, oh my God, there's bleeding. I'm not going to, flossing makes my gums bleed. I was like, no, the lack of flossing or proper flossing is what made your gums bleed. So if you can stick through it for a couple of weeks, your body can heal itself and you'll have less bleeding. Or maybe you need to see a dental professional, a hygienist or a dentist who can help you get things back to square one. And then with good habits, you can come back to health. Now, there are other systemic reasons why you could have bleeding gums. That could be if you're on blood thinners, or if you've got some cardiovascular disorders that are being treated with pharmaceuticals. It may cause your gums to bleed more easily, or any other bleeding disorder will show up in your mouth. Women, hormonal differences and fluctuations can definitely cause your gums to be more tender or to bleed more easily. So even young ladies will recommend not to have the wisdom teeth out too close to the menstrual cycle because there's just going to be more inflammation. It may be more uncomfortable. Um,
Well, that's all great, you know, great advice, great information. And I love how you brought back that the mouth is the beginning of the digestive tract, because I think eh, traditionally we don't get to think about things that way, but it is, I mean, we are all one big system here, right?
That's right. So you're taking in all your food via your mouth, right? If you're not getting it in an IV, it goes through your mouth first. And we've got lots of enzymes in the mouth that can neutralize acids and begin the process of digestion. In the process of chewing helps to break down the food so that it's more digestible further on down the line. So, yeah, if you're eating and your gums are inflamed, then you may have what we call microbleeds, where little you may not see blood or taste it or notice it, but through chewing, you may be getting a little bit of bleeding in the gums. And so that bacteria that's out of balance in your mouth is now getting into your bloodstream. It's traveling to your heart, it's traveling to your brain, it's traveling everywhere, causing seeds of inflammation and infection elsewhere. So, a lot of times, if we look at the plaques in arteries of people who are having strokes, half the time those plaques originated in the mouth. Those bacteria that are in those plaques originated in the mouth. Yeah. So people come in and they're like, "Oh, I can't have my teeth cleaned because I can't have any bleeding." And I'm like, "Oh my gosh, if you don't have your teeth cleaned, you're going to have bleeding every day." So this is not good. Yeah.
I mean, I just wonder what percentage of your experience must be crashing through these, incorrect notions, right? That everybody has.
Yeah.
Your new patient process must be re-educating. Uh, I wonder what percentage of your time is spent in re-education.
A fair amount, and also listening because we can't know where the other person is if we don't stop and listen and see what's most important to them first. I spent a good deal of time a week ago teaching medical and dental students at the University of Connecticut. And I love when I have the opportunity to do that because I was teaching them about this more holistic view and approach to healthcare and wellness, and also to their self care and their self awareness. So they are beautiful. I taught them about Ayurveda and the elements, and they got to self-identify their doshas and understand more about their tendencies and how with that awareness they can make choices proactively that support their wellness. And they can also have a better sense of where they might come off track, right? Because we all fall off track some of the times. And if you can catch it, if you can recognize it, you can say, oh, okay, I'm not a jerk or a loser because I lost my temper or because I cried at work or, because I forgot to do something. That was just um, excess fire or excess air and wind happening. And now I know, okay, what I need to do to take care of myself and bring it back in. It's that awareness helps so that we don't just spiral down into a deep dark hole or spiral up into a tizzy. It's a little stop loss gap, I guess. What do you call that in investing? This is stop loss. Yeah.
I think
So it
so,
was
yeah.
great because I was able
Yeah.
to teach these students about how to recognize these things in themselves. And my bigger goal is I can help one patient at a time, right? I can only help one person at a time. But if I can influence a group of 25 students multiple times, and they in their careers as dentists and physicians see conservatively 10,000 patients and positively impact those patients because I helped them to see the world more holistically. And then those 10,000 patients of those 25 people each affects 10 other people in their lives. Maybe it's their partners or the people they work with or their children or their neighbor. Maybe they're just a little kinder, or maybe they grant somebody grace, or maybe they just understand things in a different way. Then I've just in 1 week impacted 250,000 people. How cool is that? Like, that's really cool. And so my goal is
Amazing.
to help to change the way that we look at wellness and look at it more holistically, more integratively. Not just, okay, here's a problem, here's a prescription. Believe me, I'm grateful for surgeries and prescriptions when I've needed them. And I think we can do better. I think we can do better by seeing why is something this way. Right? I do a lot of work also with checking airways as a holistic dentist. So every single patient, we're looking for screening for cancers, precancers, viruses, or other pathology. So I'm already looking. Now I'm looking in a different way, saying, how's their airway? I don't see an airway. All I see is a big pink tongue. If they're sitting upright and awake and I can't see an airway, what happens when they're lying down and they're asleep and they get into that deep dream sleep and their airway collapses? That's not good. And so I totally changed how I look at patients and wellness in that sense. Before people come in, I'm like, oh, I'm on pantoprazole or omeprazole or famotidine or this or that, this antacid, that antacid, the other antacid. And for 20 years, when we talk about microbiome, we know that taking a proton pump inhibitor for years is not healthy, right? It is not healthy. It changes that gut flora. It changes the microbiome. And so I'll see that a patient is on this. I'm like, why? Well, I had acid ingestion or acid reflux. And so my doctor put me on this. Yeah, but why? Why do you have acid reflux? That's not normal. Do you have acid reflux because of lifestyle habits? Like you're eating a too heavy of a meal or too spicy of a meal too close to bedtime instead of stopping eating 3 or 4 hours before bed? Do you have reflux because you're not managing your emotions? You got too much of that fire going on, and so it's manifesting as breakouts or blemishes or eczema or psoriasis or acid reflux. So maybe we need to work on ways to self-manage and self-regulate, right? Whether it's breathing or meditation or mindfulness. To have acid reflux, if sometimes there could be a hiatal hernia or some other organic reason, but just giving a pill, it's so frustrating when we haven't figured out why. Are you having acid reflux because your airway is closing, because you have sleep apnea that's not diagnosed, and now your body says, "Oh my God, She stopped breathing. I better breathe her. And so the belly goes like this, but you're laying horizontal in your bed. And so when the belly does this and you're lying down, where does that acid go? Whoop, up the throat into the mouth. So patients say, oh, I can't lean back. I have postnasal drip. And you probably don't. You can't lean back because your airway is closing and you feel like you have postnasal drip because your dangle down uvula is all inflamed and goopy and gooey because it's being uh, attacked by acid reflux or by mouth breathing that's dehydrating it. It's you can tell I'm a little bit passionate about airway and breathing. It's just not,
Love it.
and it also shows up in teeth. We used to think in the 80s and 90s, oh, you've got a lot of wear at the gum line of your tooth. You must be brushing too hard. And then more in the 90s and beyond, we were saying, well, you're not brushing too hard. It's because you're grinding and clenching your teeth. And then it's like, okay, are you using something too abrasive like charcoal toothpaste or something that's just too abrasive? Or, gee, that's really shiny. 9 times out of 10, I can tell what side or if somebody sleeps on their belly, how they're sleeping because I can see where the acid corrosion is. It's like, oh, you sleep more on this side because I could see there's more wear at the gum line there. So this is why sometimes people don't even know they're having silent reflux. They're like, "Hey, are you snoring?" "Oh, well, my husband tells me I am." I'm like, he's not lying. People don't usually just make that up to be mean, right? If someone you care about or who cares about you is telling you that you have trouble breathing, you probably have trouble breathing. So that's something to look at. So you can't possibly be well if your sleep is interrupted and either your oxygen's going down or you're just never getting through a complete sleep cycle. This is holistic. This is like, I can't unsee something. I can't not look at that. I can't not say something about that. I can't ignore it or not consider it. It's it's so underdiagnosed and recognized. Um, so for me, being holistic is looking at the whole person and at the why. And it starts by being self-aware and caring for myself so that I can be that person for them. Because otherwise, I found out the hard way is it's not sustainable. Yeah.
Wow, such powerful messages. I mean, I know we we both have so many more questions.
Yeah.
Hopefully, you'll be willing to come back again because I feel that we're scratching the surface here to a lot of other questions. I know I would love it. Do you have just a real quick advice for a general person that wants to do right by their mouth? I mean, I know fluoride gets debated, I know mouthwash gets debated. I mean, is there just a general sort of, I know everybody's different, but
Yeah.
what can
No,
we
that's a
do?
fair question. Yeah, yeah, fluoride certainly is a hot topic right now that we don't have the bandwidth to go into. I am a supporter of fluoride. I'm in a state where that is protected. Um, that being said, there's a whole lot of us who are drinking filtered water and reverse osmosis filtered water that filters out a lot of those good things in it. So, a little fluoride in your toothpaste is a good thing. But beyond that, just brush your teeth and clean in between. So brush twice a day. It really is simple as that. And with a soft toothbrush.
That sounds simple. Yeah.
Yeah, it is simple. It is. And floss or clean between your teeth most days and stay hydrated. So the other simple thing to practice is that right now we're talking so our mouths are open, but Jennifer has got her lips sealed. It looks like you're nice and relaxed. It doesn't look like you're clenching your teeth together. You're breathing through your nose. That's the healthiest thing that you can do. That warms, filters, and conditions the air. It keeps the back of your throat nice and moist and healthy. Because when we're breathing like this with the mouth open, that's dehydrating those tissues. It's the same tissues, ladies, that we have down south. So imagine if that was dehydrated all night long, you wouldn't be very happy, right? It would be very irritated. No wonder we get postnasal drip and allergies and asthma, right? We're sucking in all the dust, all the pollutants, all the allergens, and they're going directly on that very, very delicate tissue. So again, I'll see patients where the uvula is enlarged. They have asthma, they have allergies, they've got reflux, they've got high blood pressure, diabetes, whatever, thyroid disease. I'm like, it is not a surprise. It all goes together. So keep hydrated, breathe through your nose, brush twice, floss once.
Well, and I love it. And with that, that brings us to our next segment, which is our silly subconscious question.
You're scaring me
And
right
our
now.
question, good, be afraid. Um, our question for you today is, if you could suddenly have one brand new talent, what would it be?
Mm. I would want greater bandwidth. So the ability to get a greater audience and just speak from the heavens that, you know, we're more well than we think. And we have more tools and resources than we think. And I just love to teach people more about Ayurveda and elemental wellness so that they could enjoy greater health and well-being. Um, I just really love to. I'm working on it, but if I could do it like that, be on all the platforms and there's a lot sillier messages out there than what I have to share. So I'd love to have that bandwidth. Oprah's got to get me on her show. Who else? Dr. Oz? I don't know. You guys got to help me here.
Well, be careful because our show, I mean, things are going to skyrocket for you from here.
There you go. Mel Robbins.
So, you've shared so much with us today. Is there anything else? Like, is there something beyond that we've talked about for the audience to know about you?
Thank you. You can get in touch with me at my website at drrobertagarceau.com. You can certainly give yourself a gift or someone you care about. My book, Bliss Not Burnout, is available on my website. It's available on Amazon. And it has a lot more of this wisdom in it, a lot more of how to help yourself, some mindfulness, some meditation. It's got 3 complete yoga classes in it to balance the different energies that we just touched upon. Like you said, it's so rich. There's so much to share. Um, but yeah, really, that would be a great resource.
Thank you again for sharing some time with us, and we really hope you'll come back. And
Thank you.
with that, Jen, what do we always say?
Peace out.
Peace out.